The health insurance marketplace, you might hear it called the exchange because that was kind of an early name for it, and some people will still use it, and that's fine. But the basic concept is this creates a way for people who are not insured to get discounts in order to buy private health insurance coverage, okay? This is not government health care. It's not a government takeover of the health system. It's a marketplace that people can get access to in several different ways in order to find out what they qualify for in the way of discounts. These discounts are based on income and family size. So you see there's some variables there. So it's not easy, it's not a simple thing of saying, what's your name, here's how much you qualify for. You have to figure that out. And we're going to be hearing from our navigator friends a little bit more about that process. The healthcare law set up three main different ways, or 3 or 4 ways that people could take part in this new process of getting coverage. The biggest one, the most high profile one, and the one that eventually is going to be the easiest one is online. Okay? It's a new website called healthcare.gov. Healthcare, one word run together, healthcare.gov. And that is going to be the place where people can either by themselves or with a helper, it can be a trained helper, and we're going to talk a little bit more about the folks who are trained to help folks, or a trusted advisor, can sit down with you and kind of walk you through this process. It's designed to be very user-friendly. Originally, the law was designed to encourage each state, because the health insurance markets are different in every state, designed to encourage each state to set up its own health insurance marketplace so that the citizens of that state, the uninsured folks, and the folks who are paying too much for the coverage they have. If you have private or workplace insurance and you feel like you're not able to afford that, then you can also use the marketplace. But it was going to be a state-by-state thing supported by resources out of Washington to help make sure they all met the requirements, but each state was going to have its own. But the states had the option of deferring to the federal government. My organization tried to make the case to Governor Bentley that Alabama ought to do an Alabama marketplace that met Alabama's needs. Unfortunately, Governor Bentley, unfortunately in my point of view, you may differ with me, but Governor Bentley deferred to the federal government. And we were one of the majority of states that did defer. As a consequence, more than 30 of the states are relying on the federal marketplace hub. And you may have heard in the news that because so many states were relying on this thing, and because the interest in it was so high, that the website is not yet up and running smoothly. It's there. Some features of it are fully functional, and I'm going to talk about those in a minute, but the main function of getting people enrolled is not working right yet online. So we're working the kinks, our federal partners are working the kinks out of it, and it should be, we're hoping that it's up and running in a matter of just a few weeks. Fortunately, there's a 6-month open enrollment period.